I would like to thank the organizing committee of the European Laser Congress for their kind invitation to present my results and the future trends of laser iridoplasty for changing eye color.
Take a very deep and thorough look at the windows to the soul, noticing every one of the intricate patterns and subtle colors hidden within those incredibly expressive eyes if you really pay attention. And these particles you see floating are the eliminated melanin. This is how the iris is progressively aligned. A nevus is a localized area with a higher concentration of melanin, similar to a small mole. That's why it responds more intensely to the laser.
The laser iridoplasty that we introduced in 2012 consists of the iridoplasty treatment. Laser with a mixed ablative and thermal laser applied only to the most superficial layer of the iris without affecting the stroma or the posterior pigmented layer at all, as you can see in these slides. And you have already seen this in the video. Laser iridoplasty is becoming another technique in ophthalmology, similar to PRK and LASIK, where we remove a thin layer of corneal tissue to correct refractive errors such as myopia, hyperopia, and astigmatism. In laser iridoplasty, we remove a thin layer of superficial pigmented tissue from the iris to a change in eye color. And just like in PRK and LASIK, we don't damage the surrounding tissues or cause side effects. Since 2012, when we introduced the technique, we have developed all the necessary tools for its progressive improvement. We introduced the first iris pigmentation classification in 5 grades. We conducted the necessary histology studies to observe the effect of different types of lasers on the superficial pigmented layer of the iris. We developed new applications for taking ocular photographs. Thank you. For the simulation of results and the software for colorimetry analysis of the iris and the evolution of the treatment. We have published our results in prestigious international journals, presenting long series of treated patients with statistical evidence showing the absence of side effects and a very high level of efficacy, safety, and predictability of the technique. And more importantly, if possible, we've statistically proven the absence of trabecular damage using aretinography, which allows us to rule out the possibility that this technique could cause chronic pigmentary glaucoma in the long term. As of today, in 2026, with more than 10,000 patients treated in both eyes, if we calculate an average of 5 phases per patient, we see that we've performed over 100,000 daily treatments in total, which fully guarantees the efficacy, safety, and predictability of this technique. To evaluate the safety of laser iridoplasty, we have carried out 2 exploratory techniques, one functional and the other anatomical. The functional technique is aretinography, which has statistically significantly demonstrated that the outflow of aqueous humor, the variable C, is not adversely affected in the long term. And the anatomical technique consisted of taking 360-degree photographs of the chamber angle using the automatic gonioscope, NIDC, which has shown a typical pattern of laser iridospoplasty with pigment deposits only in the lower part of the chamber angle. But there is a paradoxical fact. 99.9% of ophthalmologists worldwide believe, along with ophthalmological societies, that laser iridoplasty causes pigment dispersion syndrome and chronic pigmentary glaucoma, when we have statistically proven that this is not true. Let's review. That describes a pigment dispersion syndrome and subsequent chronic pigmentary glaucoma. They're described by 3 signs. First, the use of Kruckenberg. Second, a positive transillumination. And third, accumulation of pigment on the anterior surface of the lens and the zonules. In pigment dispersion syndrome and chronic pigmentary glaucoma, there is an involvement in a chronic way of the posterior epithelium of the iris, never of the anterior epithelium of the iris, and it is characterized by these three signs that never appear in patients treated with laser iridoplasty. As for the challenges we face in improving the technique, we can mention the following: continuing to increase its level of safety. Although it is already very high, being able to improve color results and being able to predict and enhance the level of brightness of the outcome, being able to perform personalized treatments according to each patient's wishes, reducing the number of phases, and ultimately achieving a single-step treatment, just as is done in refractive surgery. The improvements we are currently introducing include advanced software for colorimetric analysis of the iris, the systematic use of air tonography, and automatic 360-degree photography of the iridocorneal angle, October and angio-October in selected cases, transillumination and infrared photography in 100% of cases, and in suspicious cases, recommending a genetic test for glaucoma. When there is a family history, the use of various lasers with different effects to achieve personalized color objectives for each patient, the development of new eye drops, and finally, achieving a laser that performs the entire treatment in a single step, just like in refractive surgery. The new Analyzer Pro software gives us all the essential data needed to perform laser iridoplasty effectively and safely. First, it automatically calculates the quantitative colorimetry of the iris at the beginning and how it evolves as we perform laser sessions. Second, it gives us a two-dimensional black and white topography. By using infrared photography, we can evaluate the irregularity of the iris surface. Third, it shows us a 3D color topography so we can show the patient how their treatment is progressing. Fourth, it shows us a photograph of the chamber angle in its full 360 degrees so we can evaluate pigment deposits. And finally, it quantitatively calculates a risk indicator, like a traffic light, that takes 6 factors into account. First, the degree of pigmentation. Second, the depth of the anterior chamber. Third, the chamber angle. Fourth, intraocular pressure. Fifth, air tonography. And finally, the flare and the Tyndall effect induced by the application of laser. In this video, you can see how we use the Analyzer Pro software daily in our clinic. Although we don't use it systematically, we can perform October studies in certain cases, selected to obtain exact measurements of the iridian layers of the anterior pigmented epithelium, the stroma, and the posterior pigmented epithelium. Likewise, we can perform angio-October without the use of fluorescein to evaluate the state of the iridian vascular network before and after treatments. Transillumination photography is extremely useful for evaluating the condition of the posterior pigmented layer of the iris, which is the one affected in true pigment dispersion syndromes and in chronic pigmentary glaucoma. However, in patients treated with laser iridoplasty, these photographs do not show this deterioration of the posterior layer, since we only apply the laser to the thin anterior pigmented layer of the iris. We have recently introduced infrared photography to evaluate the density of the collagen fibers in the iris stroma. This way, we can more accurately predict the degree of brightness of the color that we will achieve at the end of the treatment. On the left, we see an example of medium density, thank you, of collagen fibers that will provide a normal level of brightness. And however, on the right, we see a case where the density of collagen fibers is very low. Therefore, the brightness achieved at the end of the treatment will be low. In this example of a grade 5 with dark eumelanin pigment, we can see through the infrared photograph that the collagen density is medium high. So we can predict that the degree of brightness at the end of the treatment will be high. The genetic test for open-angle glaucoma offers extremely high sensitivity for assessing the risk of glaucoma in patients with a family history. And we systematically perform it when a patient tells us that there have been diagnosed and treated cases of glaucoma in their family. On the left, we can see a result where only one gene is affected, and on the right, where there are 3, 4, or 5 genes related to glaucoma that have tested positive. In this way, we can accept or reject a patient for presenting a high risk. For the past 2 years, we've been using 6 different lasers, each with different effects, with the goal of achieving specific, personalized results according to each patient's wishes. We are using classic jack laser, FLT lasers, ultra short lasers, medium pulse FLT lasers, ultra long pulse FLT lasers, millisecond lasers with thermal effect, and infrared millisecond lasers for the treatment of non-pigmented tissues. As you all know very well by now, there are actually multiple different types of lasers that can achieve a wide variety of effects depending entirely on the specific parameters they use. The main parameters are wavelength, energy, pulse duration, repetition rate, and above all, the tissue effect achieved, which can range from a photodisruptive effect, for example, from jack laser, a purely ablative effect, evaporation, thermal coagulation, a biochemical effect, and finally, an effect of biomodulation. Depending on each case, the degree of pigment, its density, and the thickness of the pigmented layer, we'll choose one laser or another according to their different parameters to achieve the best personalized result, tailored to each patient's preferences. Laser iridoplasty can achieve different colors, but these are virtual and not real, unlike colored contact lenses or keratopigmentation using biological pigments. The two optical effects that explain these virtual colors are the Rayleigh effect and the Mie effect. The Rayleigh effect is what explains why an eye appears blue, and that's due to the presence of melanin microparticles on the surface of the iris. And the Mie effect is what explains why an eye appears hazel or green. And that's because of the presence of larger melanin particles on the surface of the iris. By taking into account these two specific effects and exactly how we modulate them, we can select from a variety of different laser technologies according to the specific goals and personal wishes of each individual patient. This is done in order to effectively remove more or less pigment depending on the desired outcome. And to be able to leave particles of different sizes on the surface of the iris, which create either a Rayleigh effect or a Mie effect to achieve different colors. These can be light brown, hazel, green, gray, or blue. In these photos, we can see color results ranging from light brown to hazel or light green. Thank you. Thanks to the use of SLT lasers with medium or ultra-long pulse durations, which enhance the MAI optical effect. These are the recommended lasers when the patient wants to achieve a color within this range. However, if the patient is looking for a gray or bluish color result, we need to enhance the Rayleigh optical effect by using SLT lasers with short or ultra-short pulse durations for maximum melanin removal. At the top, we can see examples of gray color results, which are usually obtained in the initial degrees of pigmentation, grade 4 and 5. And in the bottom row, we can see examples of bluish color results, which are usually achieved in the initial degrees of pigmentation, 2 and 3. Here, you can see an example of a light blue result in a patient whose initial pigmentation grade was 2. And as you can see, the color obtained is 100% natural, and the size and mobility of the pupils are completely normal. In this case, the result is a light gray in a patient whose initial pigmentation grade was 4 to 5 with dark melanin. Likewise, the color result is completely natural, and the size and mobility of the pupils are entirely normal. Let me show you some other examples of blue and turquoise color results. In patients whose initial pigmentation grade was medium, grade 3 or low 4, likewise, with 100% natural coloration and pupils that are completely normal in size and mobility. After 6 years of research with national and international departments of bioengineering, chemistry, and pharmaceuticals, we are making progress in this field. Currently, a new generation of eye drops is being developed with different applications, with heparin for dissolving pigment residues generated after laser sessions, with L-adenosine to increase tear production in patients with dry eye, with flavonoids and antioxidants to enhance the phagocytic effect of macrophages, and with inhibitors of melanin production to reduce the initial degree of pigment in patients with very dark eyes, and to provide a maintenance effect in patients whose treatment has already been completed. For several years now, we have established a high-tech research center in Barcelona, laser technology for the design and manufacture of a new generation of automatic lasers. Thank you. Very similar to those used in refractive surgery for correcting myopia, hyperopia, and astigmatism in just one step. Our new generation of automatic lasers will feature technology very similar to excimer lasers, meaning high-speed lasers with scanners and eye traftor ocular tracking systems. Thank you. Which will guarantee its effectiveness and extremely high safety. In this video, you can see what a laser iridoplasty treatment will look like with the new generation of automatic lasers, which will last just a few seconds, between 20 and 30 seconds to treat the entire iris. And it'll feature e-tracker tracking systems to ensure complete safety. Perfect, that's correct.
Seriously? Applause, don't.
Thank you all very much for your attention, and it has been a great honor for me to participate in this prestigious Congress.